Did you know that the phases of the menstrual cycle are controlled by the interplay of different hormones secreted by the ovary and the pituitary gland? At the onset of menses, the anterior pituitary gland increases the secretion of the two gonadotropic hormones, luteinizing hormone or LH and follicle-stimulating hormone or FSH that simulate the development of primary follicles. However, the amount of estrogen and progesterone released by the ovary during this time is less, which causes the thinning of the endometrium. The release of LH and FSH keeps increasing, and during the follicular stage, these two hormones stimulate the maturation of the primary follicle into the Graafian follicle. Moreover, LH and FSH stimulate the maturing follicles to release estrogen, a hormone that helps in the proliferation of the endometrium. The increased levels of estrogen, in turn, cause the anterior pituitary gland to release a surge of LH and FSH, so much so that by the ovulation stage, the levels of FSH and LH in the blood are at their peak. This LH surge causes ovulation by rupturing the Graafian follicle and turning the follicle's remnants into the corpus luteum. The estrogen level in the body too reaches its peak, and we see a gradual thickening of the endometrium. However, once the corpus luteum begins secreting large amounts of progesterone, an FSH and LH inhibiting hormone, the levels of both these hormones drop, which in turn also lowers the levels of estrogen in the body. However, the endometrium continues to thicken because of an increase in the level of progesterone. Incidentally, the corpus luteum will keep secreting progesterone if a fertilized egg gets embedded in the endometrium. However, in the absence of a fertilized egg, the corpus luteum stops releasing progesterone and degenerates. A drop in the level of progesterone, in turn, triggers menstruation as well as the restart of the release of LH and FSH by the pituitary gland. Menstrual cycles normally stop once a woman reaches her 50s. This phase is called menopause. The menstrual cycle is an important process in a woman's body, and it consists of 4 phases which are controlled by hormones released by the ovary and the pituitary gland.